and start the recording. And Donald, if you don't mind, I'll go ahead and introduce you.
Okay.
Welcome, everyone. Welcome to our office hours. It's July 27th, 2022. And today we have one of our Veteran Coalition members presenting today with us, and it's the charming, outstanding Donald Reed from McDowell County, West Virginia. Donald lives in the coal fields of southern West Virginia, and he has a vast array of experience as a faculty member, a researcher, and a clinician. He is currently the McDowell County Commission on Aging Executive Director and MPH faculty at Liberty University. And I can tell you guys are in for a real treat with Donald today. So just put your listening ears on, and we welcome everyone. And thank you, Donald, for joining us today. And just in case folks don't know, you'll be back on next month as well, doing another presentation on a total different subject. But thank you so much, Donald. It's all yours.
Thank you, Sheila and Regina. Thank everyone for joining. I am Donald Reed. I chair the McDowell County Hope Coalition, which has been a member of the Appalachian Diabetes Coalition Network for almost 20 years. Yeah. So I am a longtime coalition member, have worked with Marshall University on many amazing projects, and they surely keep me straight when I sometimes forget which report is due. But I have a long history of working with the West Virginia Division of Tobacco Prevention. I know that Dr. Kathy Danbury is on the call. I can't see all the names, so some of the other Division of Tobacco Prevention staff members may be on the call. But I have a small piece in a big puzzle, and I have worked really hard to focus on smokeless tobacco. And when I say smokeless tobacco, I'm referring mainly to snuff, chewing tobacco, as well as some vaping and e-cigarettes, but really trying to focus on traditional smokeless products that are sometimes often forgotten about as we think about, vaping and e-cigarettes. And we'll discuss some statistics, and you'll realize why that's really important in West Virginia. If I can get this to transition. Here we go. So in West Virginia, you may remember the Mail Pouch Barn, which was created by the Block Brothers Tobacco Company from Wheeling, West Virginia. And these were all across West Virginia because that smokeless tobacco is really ingrained in our culture. I would also add another fact you may not realize is that the first menthol cigarettes were also created in Wheeling, West Virginia. And those of you who may know, right now the FDA is considering a ban of all menthol products. Let's talk a little bit about tobacco use in West Virginia so we can set the stage before we get into some very specific strategies about this project. When you look at cigarette use, and cigarette use has declined, the West Virginia Division of Tobacco Prevention has worked hard for 20 plus years, and they have had an amazing impact, but we still have a lot of work to do. When we look at West Virginia, about 1 in 4 adults are currently smoking, as compared to 16% in the U.S. as a whole. When we look at high school students, in comparison to the national rate, we're more than double. So you can see, even though cigarette use has declined in West Virginia and the nation, we still have a lot of work to do here in West Virginia. Let's talk about other tobacco products. mainly focusing on adults. We have e-cigarette use at about 6%. We have smokeless tobacco use at about 8%. Now, again, that smokeless rate is those traditional products of snuff, chewing tobacco, snus, and Wyoming State and West Virginia, we alternate back and forth between who's 1 and 2. The cigarette smoking rate, we alternate between Mississippi and West Virginia, sometimes Kentucky, about who's 1, 2, or 3. Smoking and pregnancy, while not our focus here, we are in the top 5 in the nation for smoking and pregnancy as well, just so that you see the impact that tobacco has on West Virginia. Let's talk a little bit about tobacco taxes. The tax now this is cigarette tax, because smokeless tobacco is taxed at a completely different reduced rate. But a pack of cigarettes, yeah, the tax is $1.20. The U.S. average is $1.82. We rank 34th in the nation. And I will tell you that the #1 strategy for people to quit smoking or quit tobacco use is tobacco taxes. Some of you may remember the Master Settlement Agreement. And, in West Virginia, we had the Master Settlement Agreement, and roughly, it varies from like 107, what we get every year ranges, but the estimate for 2020 was 235 million in tobacco settlement payments and taxes. That's the two combined. So that's the income received from that Master Settlement Agreement and the tobacco taxes in 2020. That's a chunk of money. Now, those of you who have been around any length of time, you will remember that West Virginia securitized, or we sold those future payments to help pay off some pension. It was either pension or workers' comp debt, one of the two. It was long-term liabilities. So, and over a process of time, the West Virginia Division of Tobacco Prevention, their budget has been decreased. It went from millions to about $500,000. And while they do the best they can with $500,000, that's 1.8% of what the CDC recommends. Let's look at some other quitting statistics. The CDC estimates that about 47%, or let's say half of adult smokers in West Virginia quit for at least a day. So that shows you the desire to quit among our residents. We know that the Affordable Care Act and Medicaid does cover tobacco cessation. When we look at the quit line, we're investing about 97 cents per smoker in the quit line. The national average is $2.14. And right now, there is no private insurance mandate for tobacco cessation. That would be a great policy change to see. So let's dive further into some strategies. And this is one of my favorite quotes. And let me tell you why it's important to me. Sometimes, you wake up and you ask yourselves, am I really making a difference every day? Is the work that I do impacting my community? And on those days that I struggled, I would read this quote, and it would remind me that tobacco control has so many benefits. It has immediate impacts. It has long-term impacts on the health of a community. There are several ways in which tobacco increases poverty at the individual, household, and national levels. Now, this is going to come across as negative, but kind of reverse this in your mind as if you help people quit. At the individual level and household level, money spent on tobacco has a high opportunity cost. For the poor, money spent on tobacco is money not spent on basic needs such as food, shelter, education, and healthcare. But when you help people quit, you help that individual immediately. Short term, you help that family spend that money on food and shelter and education. And long term, you help less tax money to be used on healthcare. So you're helping your community at every level. So for those of you who work in tobacco control, and I would say this, I would say in chronic disease, never feel like that you're not making an impact. Read this quote and go to bed at night and know that you're making a difference in your community. Let's look at rural culture. And sometimes a lot of researchers want to focus on the negative parts of rural culture. I live in McDowell County. We have been studied to death, and everybody always writes some form of grant. They get a lot of money and they want to come in and save us. And they fail to take the critical step of engaging the community before they write those grants on our behalf. So if you're at one of those large institutions that sometimes do that, quit doing that. Every community or most communities have some type of coalition in them. Make sure you engage that coalition on your proposal before you submit it. But there are 4 components to rural culture that I try to build my projects around. And one is isolation. And sometimes that you think, well, isolation's a bad thing. Well, it can be, but it can be a good thing. For in the thought of messaging, I have better control of consistent messaging. Even though we have that one county newspaper in McDowell and most of the counties that we serve, I view isolation as not negative. It's a way of life, but it helps me to control the information that's coming in, where you don't really have that in a large city. We are very much multi-generational in rural West Virginia. If you can get to the gatekeeper, which is often the matriarch of the family, you can get to the other members of the family. The mother, the grandmother, the great-grandmother, especially aunts as well, they're very important as you're trying to reach the family in West Virginia, because they are often the gatekeepers. I like to say that in rural West Virginia, I'm surrounded by coal camps. And you know, if you know your history, these are, some of you in cities may call them subdivisions. I would call them housing communities. Where the coal mines built the homes, the miners lived there, but that's kind of created what I call a coal camp mentality, and these little coal camps stick together. Well, in reality, that helps you create community change, because every coal camp has a champion that you need to help work on your project. And then religion. Religion is very powerful in rural West Virginia, and religion is often the gateway to communities. You know, I did include, this is probably the most famous, one of the most famous photos of the Jolo Church in McDowell County, which my father attended this church as I was a teenager. And I included this kind of graphic picture because what I have found is the non-mainstream churches, the non-mainline denominations, you often have, I have had, let me say it that way, so it's very personal. I have had more success working with non-traditional churches in rural West Virginia than the larger denominations. So let's talk specifically about this project. And this project was built on those 4 factors that we just talked about. Now, this project is very much focused on McDowell, Mercer, Raleigh, Wyoming, Mingo, and Logan. And it's very much focused on spit tobacco. I have begged the state not to forget spit tobacco because we are number 2. And thankfully, they realized the importance of this, and I thank them for their support. While our workshops cover those 6 counties, we do try to make sure that our social media presence covers all of West Virginia. We make sure that we are in the community. Local people listen to local people best. If you don't remember anything from what I've said today, you remember that quote. Local people listen to local people best. And you have to have a presence in your community as you're addressing tobacco control or whatever chronic disease issue. In this specific project, we do tobacco cessation. We don't expect them to come to us. They're not going to come to us. We have to go to them. We very much focus on fire departments, police stations, public works in cities. Anywhere that we can find blue collar men, we show up. And the workshop's only about an hour. That's about your limit that you're going to have people stay. And we take them through the quit plan. I take them through the elements of developing their own quit plan. And then I always refer them to the West Virginia Tobacco Quit Line so that I know that they have follow-up support. So on the one piece, you have the tobacco cessation workshops. Then you have the tobacco education workshops. Because remember, who are the gatekeepers in rural communities? It's often the matriarchs of the family. So we try to focus our tobacco education workshops more so to get to the mothers, the aunts, the grandmothers, so they then take that information back to the men in the family. This project has an oral screening component. So we have 2 nurses. When I teach a tobacco cessation workshop, the nurses go with me. And then I challenge the men. We have nurses here with us today. Let's do an oral screening. Those of you who are familiar with oral health, oral cancer is very aggressive. So these screenings are very important. We also do these screenings at community events. And then, just like there's the Great American Smokeout, we focus on the Through with Chew campaign, which is in February, and focus on the Great American Spit Out. Here's some photos of our oral screenings, again, focusing on those EMS personnel. And we chose our nurses very strategically. One nurse, during the day, they work for WVU Extension, and their significant other works in the state park system. The other nurse works at a local hospital, so she's very familiar with the EMS personnel. Her husband works at a larger police department, and they are ATV riders. So, in rural communities, who you pick for your staff often can determine the success of your project. Some of our cessation workshop data. There are some key things that we focus on, and that is that we want the participants to understand nicotine addiction. And then we take them through the steps of quitting. We take them through recognizing how their body will respond to nicotine withdrawal. We take them through their pharmacotherapy options, and we work on who's going to support them at 2 o'clock in the morning when Donald Reed's not there. And we talk a lot about stress management and relapse. What happens if you relapse? All of those are very much core components of a successful quit plan. I won't go through the levels of change, and this is preliminary data. This is not finalized data, but you can see the difference in the pre and post workshop averages, and these workshops do make a difference. I do think the other key to these workshops is that they are in the workshop voluntarily. They're in the workshop with people that care about them, and that they can try to quit together as a team, or at least with the buddy system. It's a lot different than trying to quit alone. And again, we always refer them back to the West Virginia Tobacco Quit Line. Here's just some examples of our yearly media campaign. You may see these show up on your Facebook or your Instagram or your Twitter account throughout the next year. And we're constantly working to come up with new graphics. You know, as you go through social media, you have about 3 seconds to catch someone's attention. And we're probably most famous for our Valentine's Day letter. We often submit that letter throughout the state about how that you don't want to lose the love of your life because they kissed you and you had smokeless tobacco in your mouth. It's kind of a play, of course. It's a parody on the holiday, but it often does really make people think. And that letter came from Dr. Richard McDowell from WVU many years ago. We do some collaborative research. Dr. Danbury's on the call, and we've done some work on how to work with nurses in the emergency room setting, specifically on using brief tobacco interventions around smokeless tobacco. And I'll come back to this webinar that you may be interested in, but I'm going to show you this webinar training that you can go to that there's no cost. And if you would want to look up this article, you can Google the article. It was just published, I think, last year. I kind of got ahead of myself. This is the healthcare training that we were talking about. So what are some special insights? You know, what have I learned through the years that you may find valuable? And this is especially valuable if you live in the community, but it's more so valuable if you don't live in the community you're serving, but you're going in to help. You have to join forces with the people who are there. You have to buy into their mission and see how that your missions can be compatible and work together. Don't ever walk into a community with your work plan and say, here's what you're going to do. You will fail. You have to have that local buy-in. You have to guide the community. That community may not be where you want them to be. They may never get to where you want them to get, but you can gently guide them as they take steps to get where you want them to be. Those steps are successful. Don't feel like because your community doesn't change overnight that you're not successful. Community change takes time, and you have to guide them. If you push me or you tug me, you have lost my respect. And sometimes you have to challenge the way I think gently. And sometimes I have to sleep on what you've said. So your wording and your timing is very important when you go into a community, especially if you don't live there. And regardless of whether you live there or not, you need to connect yourself to the people around you. You need to look at Marshall University. You need to look at WVU. You need to look at DHHR. Who are your regional, state, and then look at your national partners. Who on the national level is working on your topic? And they should know your name and they should know your project because you should reach out to them for guidance. A few weeks ago, I think this very same group heard from the Rural Information Hub. Wonderful resource, absolutely full of case studies. Think of any topic you want to focus on, and you can go find another community that has done it, made a difference, and they give you the contact information so you can talk to that person about what went right and what went wrong. This is Kathy Bailey. She worked years ago for me on an American Legacy Foundation project. And here she's talking to a man that he lived in a camper on the side of a road, talking about quitting spit tobacco. Kathy Bailey taught me that tobacco control is a local issue. You have to have those champions on the ground. You have to have those community champions. Now, yes, those champions have to work with the Division of Tobacco Prevention, but you got to have both. You have to have the state level structure and you have to have the grassroots efforts. Either one by themselves is not effective. I realize I am a small puzzle piece in a much larger puzzle. So I wanted to make sure those of you on the call realized some other people in West Virginia who are working on tobacco control. I wanted to point out the West Virginia Division of Tobacco Prevention. They have a great website. There's their phone number. Mr. Jim Kerrigan is the director. Michelle Bowles is the prevention coordinator. She used to be an FRN director, so she surely knows the value of community coalitions. Christina Chill is the youth coordinator, and Dr. Kathy Danbury, who's been involved in tobacco control for 20 plus years and a wealth of knowledge, is an advisor to the West Virginia Division of Tobacco Prevention. We have the state coalition. Juliana Frederick, Christina Mickey, those are some names that are probably most familiar. This state coalition very much focuses on public policy, public funding, public education around tobacco control issues. Those of you who are near Cabell County, their health department fully funds Teresa Mills, who's also a wealth of knowledge. She's worked in tobacco control for 20 years. She's familiar with Tar Wars and Catch My Breath. She does freedom from smoking classes, not classes. So if you're in Cabell County, you have someone right there who and all she focuses on is Cabell County. And we also have Rhonda Robinson and Shawnita Evans. Rhonda is in Beckley. Shawnita is with me here in McDowell, and they coordinate the West Virginia African American Tobacco Prevention Network. And that is simply a faith-based network that focuses on using the power of the pulpit to help people quit. They focus on No Menthol Sundays, and in October, they have these really good trainings in the fall. They bring in Brenda Bell Caffey, who's part of the Black Center for Health and Equity. They bring in La Tanisha Wright from Follow the Signs, and they train our local people. And then our local champions, same system, different project, same system. They go back to their congregations and teach what they've learned. It's a great system. And then I wouldn't want to forget the West Virginia Tobacco Quit Line, 1-800-QUIT-NOW. I won't get into their specifics, but if you have anybody who specifically wants to quit, refer them to the Quit Line. And I did want to show you why I'm still sharing my screen. The West Virginia, the WVQuit.com, WVQuit.com. This is a training for healthcare providers. Now, presently, there's not CEUs available, but the training itself is still online. Here you have Mr. Jim Kerrigan. Then you have me talking about tobacco use in West Virginia. We have Dr. Peggy Lambert-Fink from WVU Tech talking about electronic cigarettes and then smoking and pregnancy. We have Dr. Khanna from Marshall University specifically talking about smokeless tobacco. We have Dr. Kara Pachowski from WVU talking about pharmacotherapy strategies. And I wrap it up with brief tobacco interventions. These are great webinars that you can take at your, kind of like videos that you can watch at your own time. And then I wanted to show you, well, I can't figure out how to get there. Oh, I wanted to show you the Division of Tobacco Prevention's website. They have lots of resources here. that I would encourage you to start with. I've talked a lot, and I guess I could take if there's any questions. I may not have the answers, but I can always get back to you.
Excellent. Thank you so much, Donna. What did you want us to see the tobacco prevention page? Right now it's still on the PowerPoint.
Oh, is it?
Mhm.
Oh. Well, I don't know how to make it do that. Hang on.
And there's somewhere on multiple screens. But while you're doing that, if we have anyone that has any questions, please feel free to unmute yourself, or you can put your question in the chat box.
Can you see the web page now?
Yes, we can.
So then I'm going to go back to the West Virginia or the wvquit.com. This has all those other training videos that I thought you could see and you couldn't see. Great videos. Oh, I see Teresa Mills is online. That's wonderful.
Yeah, thank you, Donald, for giving a shout out to the Cabell Huntington Health Department. We really appreciate the collaboration and the ability to be able to work on this important issue. Even, we're always open for business at the Cabell Huntington Health Department, and feel free to reach out if you or your agency are interested in tobacco prevention education or cessation. We'll be glad to help.
Teresa's like me. We've been around a long time.
Long.
Hey, Donald, we had a question. Yeah, and we had a question in the chat box that said, what is in the box?
Quit the Spit kit.
Yeah, yes.
So the Quit the Spit kits is information about smokeless tobacco, information about the quit line, and it includes a can of back off. Back off is a no nicotine, no tobacco herbal substitute where smokeless tobacco users taper off. The research says that people who quit smoking should quit immediately or taper off using nicotine replacement therapy. Smokeless tobacco users are a little different. Research says they should taper off. The patches kind of do the same thing for smokeless tobacco users. And kind of, I guess, here's the difference. A can of Skull has 60 milligrams of nicotine. That's equivalent to 3 packs of cigarettes. A much different level of nicotine dependence. But that's what's in the Quit the Spit kit. It's your kind of like your trial can of the back off product.
And Donald, there was a question. Can you clarify what the name of that product was, the herbal supplement?
Yes. I'll put it in the chat box.
Okay. Back off. Got it. I've never heard of that either.
I have some samples if anybody would want to see it. I think I have a few left here. Teresa said Walmart used to sell it. I think I have some samples left here. You could email me and I can send it to you.
That's cool. Any other questions? Feel free to type your question in the chat box so you can unmute yourself. Any other questions? Or if you have a question on how to replicate this programming if you're in a different state.
Thank you all for your time and your attention. If you come back next month, it is a completely different topic on the other part of my life.
We appreciate you so much. So we'll still keep the floor open for anybody who has any questions. We do have quite a bit of time left. However, if you don't have any other questions, or comments, we just want to thank Donald once again for being our presenter today. And we look forward to having him present in August. So we'll just keep the floor open for, I guess about 5 to 10 more minutes, Sheila. Anyone?
Yeah, that sounds good. And I have to jump off here. Donald, thank you so much. I told Regina if my battery died before, because I'm in the car, if it died or something, just to give you a big virtual hug, because you did a great job. And I appreciate all the information that you shared. So much appreciated.
I did see a question that came in. How do they get on the email list for upcoming topics?
Oh, contact Regina or I, or if you're talking about for additional virtual office hours.
I think that's the question.
Yes. I'll put my name in or my email address in the chat box.
I put mine is there as well. We normally send out notices via email to our distribution list, but we do have a monthly newsletter where we also promote our virtual office hour. So if you have a topic that you'd like to share, if you're a content expert just like Donald, we'd love to have you be a speaker as well. So we're all sharing the knowledge that we know together to help improve the communities that we serve.
And we will be happy to make a spot for you to present your expertise and share with folks in the Appalachian region. And we appreciate you all so much for joining in today.
We will be posting today's recording on our YouTube channel. So if you have anybody you would like to share the webinar with after today, you can absolutely do that. It'll be posted on our YouTube channel.
And Donald, if you have if you'll send us your slides and any other information that you have, then that way we'll shoot that out to everyone as well.
Somebody mentioned in the chat box about they really like the thought of taking the programming to the people. And some of the things I've been successful there, especially like police departments and city, what's it called? The public works men who work on the water and the sewer and the streets, is simply doing what we do here. We do a lunch and learn. And, if your community's big enough or your coalition has just a little bit of extra money, you can provide the lunch. So you got a captive audience. And that way you're not taking their time. It's still during the workday. Or sometimes cities will actually pay the men to simply sit and listen as professional development. The worst thing they can say is no. That's what I ask all the time. Worst thing they can say is no. I would want to also add maybe one of the challenges with the ATV community is lots of times those people are out of state. So the people I see are not necessarily local. So I have to find that champion who can recognize who's local and who's from out of state. Of course, if they're from out of state, 1-800-QUIT-NOW still works, but our target population is people in West Virginia.
Good question, Donald. During your workshop, do you ever do any demonstration or graph to show them how much they could save by not smoking?
Yes, I challenge them for people who need immediate gratification. I challenge them for every week, the money you would have spent, go buy you something. For people who maybe their motivation is more long-term gratification, I make them, or I suggest to them, their vacation, where could you go for $2,000, and then print you a picture of that. And that's your motivation. If you're if you can handle long-term motivation.
I think that's an excellent idea. I'm not a smoker, but I'm pointing to my Paris hat. Anybody want to quit smoking and take me with them? You know. Any other questions? Okay, I don't see any other questions in the chat box at this time. All righty, well, we appreciate you so much, Donald. You're always a pleasure. I always enjoy your presentations. You always make me smile. I think it's your personality and your face, but you just have such a warm spirit. So I always enjoy talking with you.
Thank you. I feel the same way.
Thank you. So everybody enjoy the rest of your day. We appreciate you, and we hope to see you next month in August for our next virtual office hour.